Well, Governor Gregg Abbott is easing statewide restrictions on elective surgeries. At least that's the case in the Permian Basin. His order states hospitals with less than 15% of COVID-19 hospitalizations can resume elective surgeries. Sammy Steele caught up with the chief medical officer at Odessa Regional Medical Center for more details.
Hey there, Victor. Before yesterday's order, hospitals in our area were performing very few elective surgeries. Well, now they have the green light to go full speed ahead. We're not out of the woods yet when it comes to COVID-19, but we are seeing less hospitalizations.
Looking at our three hospitals, Odessa Regional Medical Center and Midland Memorial, we've seen our hospitalizations steadily drop over the last several weeks. I would say over the last several weeks, it's been stable. It's dropped drastically from early in July when we had the highest number of hospitalizations.
Less COVID hospitalizations means more elective surgeries.
It still says reserved capacity for COVID-19, but there's an exception. There's a new exception. The new exception basically says if your designated trauma area, which we fall under a certain trauma area, has less than 15% utilization of hospitalizations because of COVID, then you're considered a low area of COVID hospitalizations versus over 15% is considered high. So what he said is as long as you're in a low hospitalization area for COVID, you can restart doing elective surgeries.
The hospital still must save 10% of its beds for COVID-19 patients, but they can now go ahead and schedule those elective surgeries that they've had to put off for months.
When you need a surgery, it always seems like it's urgent for you. So if your knee hurts and you need a knee replacement done, well, in the medical world, that's considered elective surgery. But to the patient that's going through knee pain that wants that knee replacement done, well, it's not very elective. They want it done yesterday. So this process helps us be able to expedite many of those things and get the surgeries done.
And even though hospitals will be performing more elective surgeries, that doesn't mean they're easing up on their visitor policies. For those details, you can visit newswest9.com. Reporting in Odessa, I'm Sammy Steele.